Hi everybody, it's Dr. Preston with Beachside Naturopathic Clinic here in Sunset Beach, California. And in California right now with the COVID-19, it also happens to be allergy season. We are starting to experience as a community a lot of allergy symptoms, which can be a little confusing for people as far as understanding symptoms of COVID-19 and allergies. So I just want to talk about the difference and what you can do as far as making sure your immune system is optimal this time, and what it means if you're having allergies, okay? So as far as COVID-19, the main symptoms are your fever, your shortness of breath, your dyspnea, and muscle aches or body pains. You can have some diarrhea. Some people can have sore throat. Those are a little bit more minor symptoms. And you can have a headache. So with allergies though, you can have a headache. Those are some similarities, but you're gonna have more of a sore throat in the morning that can go away during the day. That's because you have postnasal drip. With your sinuses full of mucus from allergies, they can drip in your throat at night and you can wake up with a sore throat. But you're gonna have more of clear runny nose. You don't get a runny nose really with COVID-19, itchy eyes, a lot of sneezing, watery eyes, and maybe just that brain fog, okay? That's more of your allergies. So what is the difference as far as your immune system? What does that mean when you're having allergies? What is happening with that immune system versus what's happening when you have a virus? So there is two main parts when it first comes to your immune system. So there's kind of a non-specific immunity. So that's our body's response just to initially fight anything. So pollen, toxins, parasites, bacteria. And once we're exposed to something, then we have what's called a more specific immunity, okay? And that part of your immune system is geared towards finding exactly what it is that it needs to get rid of, that it needs to attack, okay? So this specific immunity is kind of like you have a balance beam. You have two sides. So one side is your, what we call a Th1 immune response. And this is responsible for fighting bacteria and viruses. So your general immune, your non-specific, is going around, it finds something, and then it has to figure out what it is. So if it's a bacteria or a virus, it's going to activate this Th1. If it's a parasite, allergies, or toxins, it's going to activate another side of this balance beam called the Th2, okay? So right now, if you're balanced, that's good. Right now with the allergies, our Th2 is dominating. So in people with symptoms of allergies, you're having this Th2 imbalance, because if you think about it as a balance beam and you're trying to fight allergies, your immune system is going to take its resources and go this way. So as your Th2 immune response is happening, what's happening with your Th1? It's lowering. So this can affect your ability to fight viruses. In the Journal of Allergy that just came out this month, there was a good study on the rhinovirus and our decreased immune capacity to fight viruses when we're exposed to pollen. That is a big player in that. Now, once it's over, you can go back and maybe next year you switch to another way. There's a lot of factors that play into that, but when you're having allergies, I want you guys to understand there may be, not always, an impaired ability to fight viruses. So how do we make sure that we can pull this back a little bit? I know you guys aren't going to want to hear this, but if we want to decrease our exposure to allergies, then we need to avoid it. And avoiding that is not going outside, especially if you're allergic to pollens, grasses, trees, flowers that are going off right now, especially since we just had all these rain. Rain may or may not play a factor as far as viruses and pollen. A lot of times after a rainstorm, pollen will decrease in the air, so that is a good time to go outside and do your walks. Right now it's clear, but in general you want to stay inside. Now if you're allergic to dust mites, cats, your animals, this is where you really want to make sure that you are keeping your house clean. Making sure that you have dust covers for your pillows, dust covers for your mattresses. Throw out old pillows. You shouldn't use pillows more than 6 months because of the dust mites. Making sure that you're vacuuming. If you do go outside, Take your clothes off when you come back in. Leave that pollen on those clothes, okay? So again, this kind of goes with the COVID-19. Unfortunately, I know nobody wants to stay inside, but if you are having allergies, another reason even more to try to stay inside and try to wear those masks. Supplement-wise, how can we also help bring that Th2 balance down and bring that Th1? So we can do a little bit of this, okay? So we want to avoid things that stimulate that Th2. So again, anything that we're actually allergic to, we want to decrease that. We also want to decrease caffeine. So caffeine really pushes that Th2. Green tea extracts, so green tea itself, matcha green tea, all your green teas you want to avoid right now, which is fine. We don't need caffeine. That gets us more anxiety. We need to be drinking our herbal tea. Nettles tea is great for allergies. Chamomile tea if you don't have a ragweed allergy. Any kind of detox, milk thistle tea, kava kava, all those things are great to step on right now. You want to avoid turmeric. You want to avoid resveratrol. Those are healthy supplements that a lot of patients may be on right now. You may want to avoid that if you're having an allergy picture right now. And of course, any of your food allergies also. So we talk about people having a lot of food allergies here, leaky gut, and that has to do with that Th2 side also. So make sure that you're staying away from your highly allergic foods right now. Other things that you can do are boost that Th1. So if we can kind of lift that, we'll bring the Th2 down a little bit. My favorite right now is glycyrrhiza. It's a type of licorice. Not only is it great for bringing up that Th1, but it is a potent antiviral, okay? If you have high blood pressure or you don't know if you do not take this because it can cause high blood pressure, hypertension. But if you know you're okay, it's not a problem, licorice, glycyrrhiza can be a great tool for that. Grapefruit seed extract is another good herb that can help boost that Th1. All your medicinal mushrooms, okay? Your chaga, your reishi, your turkey tail is one of my favorites right now. That's also gonna boost that Th1. Now, if you don't know what side that you're on, maybe you're not having allergies, you wanna watch any Th1 boosting because you can also be Th1 dominant. And that tends to be more of our autoimmune patients like Hashimoto's, thyroid disease, and rheumatoid arthritis. So if you have those two, or you're not sure what's going on, that's where you want to talk to a doctor. We can do blood tests to really see what kind of dominance that you have. But it may not even be a playing factor in all of this. This is just, again, a tool to understand how your immune system works, okay? Another way that you can approach this are using foods or herbs that are what we call immune modulators. So they kind of work in the middle here. So they'll balance they'll work with your own body to kind of balance that. And these are things like vitamin D, vitamin A, probiotics, fish oil, so your omega-3, your EPA, your DHA, which I love. It's great for inflammation, balancing the immune system. And then glutathione, okay? So glutathione tends to be used up a lot when we have leaky gut, when we have food allergies, when we have toxins. It's just we're constantly burning through that. So we need that repleted on many levels. So glutathione is a great way and can even help quell your allergy symptoms. And then your king again right now is that vitamin C. Vitamin C, ascorbic acid, or liposomal vitamin C, which is my favorite, is what I'm recommending because it's also a potent antihistamine. So if you can do 1 to 2 grams 3 to 4 times a day with your food, that's usually a really good dose. If you start to get diarrhea, and that just means you're getting too much. So usually we say dose vitamin C to bowel tolerance. All right, so hope that kind of gives you a little bit more understanding in our immune system and things that you can do and what it means if you have allergies right now. So make sure you're staying inside. Make sure you have some help. You can do these supplements to kind of balance that out. But again, just this disclaimer is that these, again, are not treatments. These are supports and preventative measures that are non-toxic right now, okay? So everybody stay healthy, stay safe. Make sure to subscribe to our channel. We're gonna try to do these videos at least twice a week. Bye.